welcome to Your Health. Ladies and gentlemen.
Yes.
Interesting.
Absolutely.
This is for both men and women. We have something I really want you to pay attention to. And this is Dr. McWhite is going to be with us. She is a Harvard graduate and a breast surgeon, new with Baptist Health, and we are so blessed to have her. And I'd like to welcome you, Dr. McWhite, to Time of Your Life, and we are going to talk to you about some things that actually can save lives.
Right.
And you're a breast surgeon, so first of all, we wanted to start this week talking about what do I need to be looking for? And this is whether I'm a man or a woman.
Yes.
That's absolutely correct. So some of the most common signs of breast cancer would be a palpable lump, skin changes, including changes where the skin seems to be drawing inward, including the nipple. Breast pain is sometimes a symptom of breast cancer, and then bloody nipple discharge.
Okay, and how often, for those of us who are going through the process of checking at home, which is what we should be doing, how often do we need to be doing that?
All right, this is an important question. In the last several years, an organization, the U.S. Preventive Task Force, has suggested that doing self-examination is not essential. This is where I depart a little bit from that recommendation. You know, no one can know what their normal exam is better than the patient, the man or the woman.
That's right.
And so they argue that because most things that patients detect on their own turn out to be benign, not harmful, that it causes undue anxiety, and sometimes maybe a biopsy is performed that is unnecessary. Personally, I argue that I would rather a patient discover something and eventually turn out to be harmless than have a harmful lump that was easy to feel but they didn't check.
Go ahead. A real important question then obviously is early detection. Is that a key?
Absolutely.
Okay, great.
We can thank early detection for decreasing the rates of mortality from breast cancer significantly over the past 20 years. We've done so much good work in educating patients about the importance of obtaining a mammogram, discussing their family and personal history with their primary care doctor, and doing self-examination. I would hate to see us undo all of that good work. I know that this is a topic that causes a lot of fear and anxiety, but most patients who feel something in the breast are going to get good news at the end of the day. And if there is something worrisome there, we want to find it as quickly as possible. When we detect breast cancer in the earliest stages, we have an excellent chance of curing that cancer. For a stage 1 breast cancer, for example, the rate of cure is higher than 95%.
Wow.
And for a non-invasive cancer, a ductal carcinoma in situ, we expect those patients to be cured, period.
That just shows how far we have come.
Right.
And that is amazing. And frankly, I would rather have a little anxiety than be dead. So,
right.
Again,
I'll say, that is my personal opinion. The guidelines for screening have been under revision because of this task force for the past few years. Previously, we recommended that all women obtain a yearly mammogram starting at the age of 40. The American Cancer Society has backed off that a little bit and said, perhaps if you're at average risk, so no family history, no personal history, et cetera, that maybe you could begin those yearly mammograms at the age of 45. I would argue that I see too many patients in their early 40s, even 30s with breast cancer. So again, review your family history, have an ongoing conversation with your primary care doctor so that you know when it's appropriate for you to obtain your initial screening.
I do have a question that I've been asked by some ladies. We talked about the subject of dense breast tissue has come up quite a bit, and the topic of the 3D mammograms. And could you give us your input on both of those?
I would say that over the past 10 years or so, the importance of breast density has really registered with physicians that treat breast cancer. When you have a dense breast on mammography, you tend to have a pattern where the entire mammogram looks a little white. And unfortunately, harmful things in the breast are also white, and they may hide in that normal dense tissue. So it might be harder to diagnose something on mammography for a patient who has a dense breast. In addition to that, when you palpate the breast as well, if everything feels firm, then that lump might not be as easy to detect. So breast density is important. 3D mammography adds that extra bit of investigation. It helps us to see that breast tissue in a slightly different way. The process is similar to a regular mammogram, and it really only adds about a minute or two to the
procedure,
to the visit. Right. And basically, the imager scans across the breast so that you have, in essence, a 3D view of the breast. And then that can be manipulated with computer programs so that you can kind of turn and spin that tissue around. So if there's an area that you say, I'm not sure about that spot, then you can really readjust that image to be sure.
Okay. Well,
I was going to ask her, is there any, that sometimes people have said that if a woman has used birth control measures, that they're more apt to have breast cancer. Is there any truth to that, or is it just kind of a myth?
It's not really a myth, but that's kind of with the older the older contraceptive medications that use higher doses of estrogen. With the current dosing, that's less of a concern.
Great.
Well, in recapping, and first of all, let's make clear that not only do women get breast cancer, but men do also.
A very dear friend of ours, a male, had
breast cancer. So if you could just recap and say, here are 3 major things that I want to say to all of you out there, what would they be?
The first and most important is early detection really does save lives, and those measures that we discussed, checking, talking to your primary care physician, those things are essential. Next, if you feel a lump, contact your physician. Get in with your primary care doctor. It might be your internal medicine, family medicine, or OBGYN. Don't just sit on it. Don't just ignore it. And then finally, we have excellent cure rates. So, get in there early and take care of it.
Well, thank you so much. We're going to bring you back next week, because now we're going to find out about what you need to do if there is a problem. And just remember this, take care of yourself. You're responsible for your own body. We'll be right back right after this.